Schistosomiasis is a parasitic worm disease transmitted by in the life cycle of the disease, very important, an intermediate host snail. So the human become infected when he or she contacts open freshwater bodies that are infested by the parasite. We estimate that approximately 800 million people are at risk, and probably about 250 million people are currently infected with schistosomiasis. Primarily in sub-Saharan Africa, 90% of the cases are concentrated in sub-Saharan Africa. However, the disease also occurs, for example, in Brazil and also in China. If we look at the disease pattern in humans, it's primarily school-aged children. The water contact is the main area where the disease occurs, and this often in sub-Saharan Africa are school-aged children because it's hot outside. Children like to play in water, so that's why we see the highest prevalence in school-aged children. Children age range 5 to 15, 16 years. Difficult to say. There might be some acute symptoms, fever, Katayama fever, but most importantly, it's a chronic disease. So after years of repeated infections, symptoms might occur. There are two main forms of schistosomiasis, urogenital and intestinal. For example, typical symptoms of intestinal schistosomiasis would be abdominal pain, maybe diarrhea, bloody diarrhea, general fatigue. The current treatment of choice is praziquantel, a drug that has been developed in the 1970s, 1980s. It is now provided free of charge by a large donation program. In Africa, we treat people at a single oral dose of 40 milligram per kilogram body weight. Very simple. If you don't contact open freshwater bodies, you don't get the disease. To have the disease transmitted, it needs humans contacting open freshwater bodies, and these open freshwater bodies must be infested by the intermediate host snail. So if you don't get in touch with the water, no risk of infection. As I mentioned, it's a disease of poverty, so the main challenge is we talk about diseases in rural, remote areas where people don't have access to clean water, they don't have access to sanitation, poor hygiene behavior. They are forced to contact open freshwater bodies for their daily activities, occupational, recreational. So this is one of the main challenges, to bring education to these people, but also to bring alternatives like clean water access so that they are not forced any longer to contact open freshwater bodies. We see that in the last 10-15 years, considerable progress has been made in terms of bringing the number of infections and, most importantly, the infection intensity burden down. This has occurred mainly through large-scale preventive chemotherapy campaigns and also, in many of the African countries now, sustained social economic development. Schistosomiasis is treated by a single drug, it's praziquantel, developed in the 1970s, 1980s by Bayer, a company in Germany. And once then the patent of this drug was running out and there were generic drugs on the market, this played a huge difference in tackling the disease on a global scale. Before that period, it was very complicated to treat people. There were toxic drugs that needed to be employed on multiple courses. With praziquantel, we had a main game changer because it's a drug that can be utilized at a single oral dose, highly efficacious, and only minor little minor adverse events. Big advantage is it can be employed at large scale as a single oral dose. As it is highly efficacious and safe, it can be administered without prior diagnostics. In sub-Saharan Africa, where the social and economic development is still relatively poor, this is the most cost-effective strategy. You treat at large scale without diagnostics. Big disadvantage is we only have currently one drug available. If resistance develops to this drug, there is a big challenge in how to treat, how to control the disease. So there is a pressing need to develop alternative drugs. A lot of research on the way. However, developing a novel drug is extremely costly. Here we estimate maybe 300, 500 million euro. Therefore, often we try to utilize existing drugs that are employed for other applications and then see whether or not these drugs might also have an effect against schistosomiasis. Give you one example, some drugs that are utilized against malaria also show activities against schistosomiasis, and this would be a shortcut to have a drug available already on the market with a novel application. In terms of the drug research and development, there are a couple of institutions, for instance also the Swiss Tropical and Public Health Institute, but there are a few other institutions, usually tropical medicine institutions, but most importantly also some of the public-private partnerships, the product development partnerships. Here I give you an example, the Drugs for Neglected Disease Initiative in Geneva. They work on exactly developing novel drugs against many of the neglected tropical disease. And this is done in partnership with academic partners, with the private sector. We talk about neglected tropical diseases. So still also in terms of research, awareness, global recognition, still highly neglected diseases. So it is still today a big challenge to obtain major funding for these diseases to pursue research and control. I think it's important to bring new people, new enthusiastic people into the field. And again, over the past 10-15 years, we have seen that indeed it is worthwhile to work, put the own scientific career on neglected tropical disease. If we then have a new tool, a new drug, maybe a vaccine, we can have a major impact also on a societal level. So I think it's also a meaningful work and therefore interesting for young people to engage in this sector.